Hello and welcome to Inside Healthcare. As we begin this new year, there were more than 3,000 new COVID-19 cases, about 850 people hospitalized, and 13 deaths in Minnesota on the first workday of 2021. However, this new year brings some encouraging news as more than 74,500 healthcare workers and long-term care facility residents in Minnesota have already received their first doses of the COVID-19 vaccine. To find out how COVID-19 is affecting our Latino population here in Minnesota, we go to the front lines for some answers.
We're very pleased to have back with us Francisco Ramirez with mHealth Fairview. So thank you for being back with us and to share your expertise, especially with the Latino population. Can you begin? Glad to have you with us. Can you begin by telling us how has COVID-19 been impacting the Latino population here in Minnesota especially?
Yeah, and thank you for having me. I'm grateful to be here. And it has been an amazing and really hard year since 2020. And the Latino community has been affected in great numbers because those works that they have, unfortunately, they are not able to do it from home. Then many of the Latino community work at construction sites, store supplies, restaurants, and other places like that, and they have to be there. Then also one other problem that we have seen with the Latino community here in Minnesota, and I'm pretty sure that is across the US, is that more than one family sometimes live in one house. Then has been a huge problem in terms when somebody get COVID, the other family members that are at the same house, of course, they are in a higher risk to get COVID.
Are we seeing that it's affecting and being impacted more by our senior population, Latino population as well? Is that what you're seeing?
Yeah, well, I mean, we know that right now by the numbers right here in Minnesota, we have been doing like testing in different places, and then mHealth Fairview, then they have been working together with MDH and Ramsey County. And then what we have seen is just like, yeah, many of the senior community live sometimes with their children, and then they take care of the grandchildren. Then it has been a challenge I don't have the specific number about the Latino community that they have like affected by COVID, but what I can tell is about 38,000 cases, positive cases across Minnesota with the Latino community for COVID-19. Then it's a huge, huge number. And those numbers, I believe, then can be even higher.
Wow, that's incredible. How is Latino population coping with some of the stay-at-home, the social distancing? As you mentioned, many of these were essential workers that had to still go to work and things like that. How are they coping with the CDC and the state health guidelines?
Yeah, we have been like promoting a lot of info and resources to the Latino community through different ways. Our message has been since the beginning, you are not alone. We are working together with MDH, Ramsey County, many other agencies, Hennepin County. It has been hard, but at the same time, it's like the more info that we provide to the community, the better informed than they can be. Because there is a lot of misunderstanding with some things, or there is a lot of bad info that is there. And sometimes we have to say, no, let's just go and check what the info is through the CDC, the FDA, and also the MDH. But we have been like, the message is like, stay at home. If you are able to stay at home, wear a mask. It's extremely important if you need to go out of the house to get groceries or any other items that you might need. Washing hands. We have to keep like sending this message over and over and over. Why? Because also the social distance if you are out of your place. Why is extremely important? Because many of community members, they think like 2020 was the bad year. 2021 is going to kind of like, it's over. But no, this is not over. The pandemic is still here with us. We know that the vaccine is coming. we can talk a little bit more in a little bit, but the problem, the COVID-19 disease, is still with us, unfortunately.
And you were involved in mHealth Fairview successfully with Ramsey County doing a number of COVID-19 testing, reaching out to the community at large. And that was very successful in detecting the cases out in the community and helping to stop spread the disease as well. Tell us a little bit about that experience.
Yeah, this it has been a great experience about for me to see how well we have been working and coordinating these events and testing events with MDH and many other agencies. But there is a team at mHealth Fairview at Community Advancement, and they have been providing COVID testing in different locations. Then I have been working really closely at the Mexican Consulate. That's a location that we have opened. We were providing COVID testing every other Wednesday. Last year, this year, we're still talking how this is going to be the first quarter, because this was the nasal swab that we were doing there, and the nasal swab and also the throat swab. But now with the saliva test that we are going to have or that we have right now, maybe a little bit different, but the place that we were there at the Latino community, for the Latino community at the Mexican Consulate, was open for anybody. Then it was there, the location, but this is a place that it was open for our diverse communities, and anyone can go there. It's confidential, it's free, with symptoms or no symptoms, and the results are given to you in 48 to 72 hours.
As you mentioned, the COVID vaccine is now available. Thousands here in Minnesota are getting the vaccine, the first rollout. And I think I heard even as early as today, some are getting their second vaccine as well. How does the Latino population in Minnesota fall into the priorities of distribution for this vaccine? I know at first it was healthcare workers and the long-term healthcare facilities and stuff were getting it first. How does the Latino population fall into the rollout of the priorities with the vaccine?
Yeah, and then there is a protocol and guidelines and mHealth Fairview that they have, and then they are following in terms of which phase are providing these vaccines. Of course, as we know, the 2 COVID vaccines approved by the FDA that we have right now, unfortunately, those vaccines, we are not able, or I don't think that we are going to be able to easily provide those into the community settings for all the requirements that then these vaccines are applied in hospitals or clinic settings. They are going to be, but there are going to be, I'm hopeful that there are going to be a few more that are coming. I don't know if there are going to be the first quarter or second quarter. As soon as they are approved by the FDA, mHealth Fairview, we are committed to provide these vaccines and to help the community, not only to the Latino community, to all of our diverse communities. And then we are going to kind of work together with MDH to see how we are going to have a plan to provide this in different settings. But for now, they are applying this or providing these vaccines only at clinical hospital settings.
So to keep watching for information on when people can go ahead and get the vaccine, especially the Latino population in the months ahead, perhaps. Some just keep watching for the information becoming available. Yeah.
The vaccine is safe. This is the message that we want to send to the community. As soon as I'm able to get mine, I think I'm going to record kind of a video to show that this is safe. We have an amazing technology that I know that sometimes it can take years to develop or to have a vaccine, but I want to send a message to the community that please connect, get the information through the FDA, to the CDCs, and of course, with MDH, the Minnesota Health Department, to see which places are going to be able to provide these. They have resources in different languages. This is they have been doing a great work. I'm so proud to be in Minnesota because we have this kind of sense of helping each other, and this is what we want. The community, my message that I want to send is you are not alone. If you need more information, please, you can reach us to us at mHealth Fairview Community Engagement Department. We will provide the number by the end of the program. But please don't go and get information in places that they are not able to have like scientific information behind. Then please go to the MDH, CDC, or FDA.
And what final advice would you have for the Latino population in staying safe and healthy in this new year of 2021?
Yeah, we have to keep like following. We keep learning, Yori, from this new virus. It has been already almost 1 year. But as a doctors and scientists continue to gather new information every day, it's extremely important to take COVID seriously. This is not over. We do not yet know all of the negative effects that they can have, especially if you have a chronic disease. But it's important to kind of like, the message is to keep working to slow the spread of the virus by staying home if you can, staying 6 feet apart, wear your mask, wash your hands, and please just kind of like follow the guidelines from the MDH and our government here in Minnesota.
Well, very good information for our viewers to know, especially at this time when there's so much misinformation out there as well. So thank you so much, Francisco, for being with us and sharing that information with us. And we'd love to have you come back maybe later in the year and see how things are going then.
That would be great. Thank you so much for having me, and thank you for reaching out to share this with the Latino community.
I got some Oxy after I hurt my neck. First, I took them to feel better. Then, I just kept taking them. I didn't know they'd be this addictive. I didn't know how far I'd go to get more.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
Joining us now is Dr. Craig Maddox with the Urgency Room on the importance of recognizing the warning signs and symptoms of non-COVID health conditions like a heart attack and to not ignore them.
What we've experienced both in the emergency departments where I work part of the time and in our urgency rooms is people are doing their best to try to abide by guidance that they avoid public gathering spaces, that they try to stay away if they can because they know that hospitals or other clinic sites are seeing patients with COVID, and so they have concerns for their own personal safety. However, I think what patients need to recognize is that there are avenues for getting care that don't involve going to the emergency department, even if you have concerning symptoms. Sometimes based on the duration or severity of your symptoms, you could certainly contact your primary care provider through the electronic systems that your clinics have set up. And that sometimes is either just a chat function or a televisit. But an alternative too is going to sites that are remote from the emergency department or your clinic, where those services that you might receive in those locations are readily available. In the urgency room, the 3 locations that we have is certainly one of those. And the things that that we're seeing is patients having concern that, because the COVID pandemic is in such full swing right now, that their clinical providers and clinical sites of care are only seeing patients with COVID, which is not the case. And I think they have concerns that because they are seeing patients that have COVID, that somehow they're going to be at higher risk for being seen in those locations. And I would say that most of the clinical sites are doing their best to create conditions for social distancing in their lobbies, asking patients to remain in their cars while they're being registered, not hanging out in the facility until a room is available, et cetera. And those are some of the things that we're putting into place in the urgency rooms. As far as conditions that patients might be ignoring, I think, when patients are experiencing symptoms of chest heaviness or pressure, dizziness, lightheadedness, feeling like they might faint, feeling their heart race or beat funny. Those are all things that a qualified emergency physician can see in the emergency department, but we can also see in the urgency room. And one of the nice things about being seen in the urgency room as opposed to an urgent care location is we have the ability to do advanced testing and do medical or therapeutic interventions that might not be available to you in your doctor's office or in an urgent care. And if we ultimately decide that you would benefit from hospitalization, historically we've been able to arrange that such that you go directly into one of the hospitals of your choices or where they have the services that you require, essentially bypassing the emergency department. That's been a little more difficult as the stories have emerged recently around the staffing challenges that hospitals are having, and what that creates for them in their ability to fill all the available beds that they have, both in the ICU and on their regular floor wards. We see patients who may be having concerns about their blood pressure or their blood sugars, fever, and those kinds of chief complaints or symptomatic concerns that, again, are well suited to the type of care that we can deliver. We have seen a reduction, it seems, in traumatic injuries in the emergency rooms. I think people are just, a little more quiet, right? There aren't the sports leagues going on. People are staying inside. And so we aren't seeing that type of activity in our urgency rooms, but certainly we're here for that as well. And fortunately, we have not seen influenza yet, but we typically expect it to occur, around this time of the year. And I think, that might be one of the very minor side benefits of the actions people are taking in regards to the risk of COVID with social distancing and masking and hand washing, that it is actually protective against some of these other conditions that we normally see as winter comes around. People are in closer contact generally, and the transmission of those conditions is easier. So the common cold, strep throat, influenza, RSV, we're still waiting to see if we're going to experience an uptick in that in our environment. But again, we have the ability to help patients who have concerns for those conditions. It is not just all COVID right now.
Last fall I had longtime TV anchor Diana Pierce on our show here, talking about that she had a health scare and that she wanted to get the word out to everyone to be aware of the warning signs of a stroke. And hers did not turn out to be a stroke, but she wanted everyone to be aware of that because she had lost her mom to a stroke and things like that. So again, what would be those symptoms that people might dismiss or may go, well, that's really nothing? I mean, what are some of those things that they should watch out for?
Yeah, I think I think stroke is an important one, and certainly if someone believes they're having a stroke and has really overt or obvious symptoms of neurologic impairment, they really should seek care in an emergency department, right? Because many of the interventions that we have to offer for patients who are suffering from symptoms of a stroke are time dependent. And obviously we want people to access those resources as quickly as possible. That being said, a lot of the time when people come in out of concern for the symptoms that they're having, it turns out, fortunately, that they're not having a stroke. But the obvious things that we would want people to seek evaluation for that should be pretty clear for them and are time sensitive and actually are amenable to certain interventions would be things like the inability to form language or to understand language. So if you're having speech difficulty or having difficulty comprehending language, that's an obvious one. If part of your body isn't working the way it used to, meaning that it feels weak or you can't control it, that's another. Visual disturbances can often be associated with symptoms of stroke. So it's in those instances where patients have or people are experiencing obvious neurologic impairment that we would say don't ignore that, and really you should go to the emergency department. Now, if you're having mild symptoms or you're not sure if your symptoms are stroke related, certainly you can, depending on the abruptness of onset or the duration of the symptoms, it might be reasonable to be seen in one of our urgency rooms, because we do, again, have physicians who are trained in quickly recognizing the symptoms of stroke. We have the ability to evaluate you for stroke. And if we find it, we do have processes that we put into place with local stroke treatment centers to facilitate that immediate care that you might need.
You know, the one I keep hearing from a couple of different people, and I don't know necessarily if it's COVID-19 related or just that they developed pneumonia and they didn't realize that's what it was. But what would be some of those symptoms that someone should be seen by an emergency care doctor with possible pneumonia?
I mean, there's a lot of overlap between, respiratory illnesses like influenza, which causes, respiratory or lung symptoms, pneumonia, which is an infection of the lung, which can really be caused by a virus or a bacteria or a fungus. There are a variety of causes of pneumonia. And COVID-19, which is a virus, does cause a pneumonia in the lungs. But what we would want to add to the evaluation would be consideration for a secondary infection at the time your immune system's busy fighting a viral infection. Sometimes it's distracted from its ability to fight a bacterial infection is compromised while it's busy fighting a viral infection. And in that instance, checking a chest X-ray and looking for a particular pattern that's more consistent with a bacterial infection as opposed to a viral infection might provide your clinician, your doctor or physician's assistants or nurse practitioners the opportunity to prescribe antibiotics, so medication that works against bacterial infections. Because as of now, except for in the hospital, we don't have a lot of therapies that are directed specifically at the viral infection caused by COVID-19. So the things to look out for really are, the classic symptoms: fever, sweats, chills, cough, especially a productive cough, but not always, meaning productive of sputum, chest pain and shortness of breath. Those are sort of the hallmarks of a pneumonia. As patients age, sometimes those symptoms are less obvious, but those are the pretty typical ones. And again, being seen at a site of care with a physical evaluation and maybe imaging like a chest X-ray would help further clarify the diagnosis. I get a little concerned about some of the efforts we've made to try to meet people where they are through telemedicine and trying to diagnose pneumonia or ear infection or strep throat over the phone or through a video chat function. So certainly pneumonia would be one of the things that we'd want you, if you're worried about having it, to get in and be seen for.
Would that be the same true for appendicitis as well?
Sure. There are a number of abdominal conditions that can develop spontaneously that require an in-person exam, laboratory evaluation, and maybe advanced imaging like a CT scan. Appendicitis is one of those. Diverticulitis is another common cause of abdominal pain that can come on spontaneously, does require treatment. As opposed to appendicitis, historically, diverticulitis often responds to antibiotics. So you might not even need to come in the hospital depending on the severity of your symptoms, the severity of the findings on your CAT scan. You might be able to be managed at home with oral antibiotics, and that's something that can be accomplished through a visit to your provider or something like the urgency room.
Any final comments for our viewers on things maybe to watch out for, or things that they should be seeking emergency care, like at the urgency room, and things that you can provide for them?
I think it's really around symptoms that you feel like you aren't able to manage at home, meaning, if you have a low grade temperature and a mild cough, that may not require a visit to the urgency room. But if you're really struggling, you have terrible sweats, chills, and high fever, or you have nausea and vomiting that you can't manage at home, or you're having diarrhea that you're having trouble keeping up with via your oral intake. Those are all things that are really amenable to quick intervention. And, the longer you wait, the harder it is to reverse the consequences of those illnesses. And certainly when we see you earlier, we're able to reverse the course more quickly by identifying the problem and the appropriate therapies and then beginning those for you. So if there's symptoms that you feel like are beyond your control, those are things you should be seen for.
Well, Dr. Maddox, always great to have you on the show. Thank you. Great
Yeah.
information.
Appreciate the opportunity.
Finally, hundreds of local kids are starting this new year off sleeping in a warm bed thanks to the generosity of those in our community and the folks of Slumberland with their Homes for the Holidays event. We talk about this heartwarming program with the president and CEO of Slumberland, Kenny Larson, who tells us even more kids in need of beds can benefit from their 40 Wings Foundation throughout this new year.
Set up the foundation a number of years ago with the sole purpose of trying to provide kids mattresses that are sleeping on the floor. And obviously the needs are tremendous all the time.
Beds are something we're really good at, and there's a need for beds. And so Homes for the Holiday began in December. We would give away beds. So to date, this year, we gave away 2,500 beds across 12 states. The Twin Cities gave 350 beds away to 6 different charities, and we just did that last week.
You think about what it would be like sleeping on a floor, whether it's, pile of blankets or whatever makeshift that you have, and then you think about getting up, going to school, and trying to do your best work. And it'd just be incredibly difficult.
Wings is goes on all year long. So we work with charity partners in our communities in which we have a Slumberland, and we try to get kids off the bed throughout the whole year.
We really look to them to find the families that are in need, and then we support them by donating them. So we have employees that are giving, we have suppliers give. A number of our customers, when they hear about it, make donations too, and that just gives us the ability to leverage more and more mattresses.
Currently, one of the children is sleeping on a couch, and the other is on a worn-out air mattress, and the third sleeps with the parent. Is there any way you would be able to help with this wonderful family? So it's those kinds of letters that just rip your heart. So being able to get these families some beds and a place to rest their head.
Our mission is we want to improve the lives of our customers and strengthen communities. And we think with this Homes for the Holiday event and our 40 Wings Foundation that it really does both of those.
Well, that's our program for you. We hope you can join us next time on Inside Healthcare. We'll see you then, everyone.